Hello, sir. A huge pleasure to have you on the podcast. Could you please introduce yourself?
Hi, Akash. Nice to meet you. My name is Farooq Naeem. I'm a professor of psychiatry at the University of Toronto, and I'm also a psychiatrist at the Center for Addiction and Mental Health in Toronto here. My you have to forgive me for my cough. my my area of research is psychotherapy and culture, and especially a form of psychotherapy that we call CBT, or Cognitive Behavioural Therapy.
So, what we are going to speak on is the cultural barriers faced when practicing CBT. So, I want to ask by starting, what are some of the cultural barriers that a psychologist may face when dealing with a client from a different culture from their own?
Yeah. So I think there are two kind of ways of looking at it. First, let's talk about uh, cultural barriers
Mm-hmm.
that psychologists in the West experience when they are seeing patients from a different culture. And I can focus it on South Asian clients, like it'll be more relevant for your audience, possibly.
Mm-hmm.
So people from India and Pakistan, Sri Lanka,
Mm-hmm.
Bangladesh, so the South Asian countries, okay? And the second is obviously uh, the the uh, the barriers that people from, or the therapists who live and work in South Asia using CBT, that's a Western therapy, right? So these there are slight kind of differences, not anything major. So first, when it comes to psychologists or therapists, because most therapy in Canada and in UK, where I have worked, uh, is provided by therapists who are not psychologists, because of the cost. You see here, the system promotes psychotherapy uh, by less trained therapists. Okay,
Mm-hmm.
so these are people who are mostly from social work background, nursing background, but also less trained psychology graduates. You see, the main issues are, and the main issue is, sorry, that CBT was developed in the West, so
Mm-hmm.
it is aimed to promote Western values, for example, independence. Now, people like us from South Asian culture, we are not independent, right? We live in a communal system, so families are very important. The North American model, typically of independence of individual, does not apply to our cultures, where people are more sort of family oriented. I give you an example. Uh, what we have a concept of dysfunctional beliefs,
Mm-hmm.
because cognitive therapy tries to address the belief system, right? Now, so for example, sacrificing your needs for
Mm-hmm.
the needs of people around you is a dysfunctional belief in Western societies. But in our societies, it's not a dysfunctional thing. It's seen as a high esteem, people who sacrifice their needs, right? That's a cultural and spiritual kind of value in our system. And that's regardless, whether you're Hindu or you're Muslim or you're Buddhist, that's how people function. And so you see, that's the kind of the belief system. That's the kind of differences how people look at some of the belief system. So that's to start with. The second thing, uh, 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 people from South Asian cultures, they have so much faith in religious and spiritual causes of mental health problems. And not just mental health problems, all kind of problems, right? Uh, uh, so here, a patient will think that their depression is because of chemical imbalance. But uh, uh, and also, stresses and social and psychological causes. But in our cultures, people believe in spiritual causes of mental illness as well. Surprisingly, there's a strong biological component as well. And I give you an example. Now, many people in our cultures, they think that, psychiatric problems are caused by genetics.
Mm-hmm.
So they are transferred from one generation to another. And that actually, interestingly, leads to stigma. So that's, when people don't like to get married to someone who has a family history of mental health problems, a lot of stigma comes from, and that's why many families hide their family members with mental health problems, so others don't know. So there's a very interesting aspect of biological, in terms of biological origin of problems. But going back, predominantly people believe in spiritual sort of causes of mental illness. For example, among the Muslims and Sikhs. So Muslims and Sikhs, for example, they believe that doing wrong things, not being a good follower, can make you depressed. Okay. Similarly, in Hinduism, the concept of karma means that many people believe that it's the bad things they have committed in the previous life that might have brought depression and other problems in their lives. So it's a huge kind of spiritual component, and therefore the first thing a therapist should do in these cultures is to try to understand their religious and spiritual belief system. Without that, you might think that they are superstition and all kind of stuff. And a lot of them possibly are from scientific point of view. But you see, if you just say to a patient, oh, look, this is just superstition, a patient will not trust you. Another example is a black eye, right? Black eye, and that's a concept that's throughout Middle East and South Asia. That somebody gives you a bad or evil eye, they just they have bad wish, and that makes you that causes both physical and psychological harm. So that's about the causes of mental health problems that a therapist should think about when they're dealing with these problems. When they are from, when a therapist is from European or Western sort of background. And another aspect that's very important is what we call acculturation. Acculturation means how well a South Asian person is adjusted to a Western society. Right. So, for example, are they still kind of sticking to their original belief system, or they have modified their belief system and they try to adopt the Western belief system, and that's on the basis of the same kind of barriers that I have discussed. Family can be a huge barrier too. Here in the West, people, therapists think that, because of privacy, you can't say anything to the family. Now, the problem is, if you do not engage family, patients will not talk to you anymore after 1 or 2 sessions. So these are the main kind of barriers. And obviously, then there are issues where we have to adjust therapy techniques, literacy, for example, which is not a huge concern here. But as I mentioned, we'll talk about how these barriers affect therapy in South Asia when the therapist and the patient both are South Asian, living in South Asia. They have an advantage in that obviously the South Asian therapist will understand this kind of these barriers. Problem is many South Asian therapists like to use a very pure kind of Western model. They don't like to adjust it.
Right.
And that is where the problem is. That's where the problem is, So whenever I talk to therapists in South Asia, people from India, Pakistan, therapists, and I say to them, look, you need to think about the culture. Do not think that you can use the Western technique as they are with your clients. Think about the background, think about the factors we just talked about, like the belief system, culture, religion, their understanding of causes of mental health problems, and family and privacy. So these kind of things. So not that big kind of problem, because as I said, therapists in South Asia have knowledge of the culture and religion of the client, but those who do not modify therapy, they have difficulty in engaging clients.
Right.
Yeah.
So how can CBT be oriented towards marginalized communities?
Yeah. So that's where my whole work has been, to modify CBT for clients from different sort of cultural backgrounds, and the module that I developed originally was for South Asian, but it's been now used to adapt CBT in Middle East, in Morocco, China, UK, in Africa, and now in Canada. And the module that I have developed has 3 parts. So people, when they want to adapt or modify CBT for other cultures, they need to think about 3 main areas. Number 1 is the assessment and engagement. And for assessment and engagement, you need to think about the religious and the cultural barriers, and so that is the second part, which is awareness of the culture and religious factors. Okay, and the third part of the module is adjustments in therapy techniques. So overall, the model suggests that number 1, you need to make yourself aware of cultural background or the belief system of the patient. So just being aware of their background can help you. Second, you need to be aware of your own belief system, right? Because if you're not aware of your belief system, you will not be aware of your biases towards others. And even in South Asia, you can imagine a Muslim therapist seeing a Hindu client, or Hindu therapist seeing a Muslim client, or one of them seeing a Sikh client. So being aware of your biases is a very important thing. Being aware of your own belief system, so that if you know your belief system, you can address those beliefs, right? And then in terms of adjustments in therapy techniques, they're not a really huge kind of issue. For example, some techniques which are more behavior oriented, like problem solving, or behavioral activation, which means in helping person to increase activities, they are culture free, if you like. So you don't need to make that many changes, except you need to think, like, for example, you can't ask a patient from a South Asian background, especially if there's a client is Muslim, to to go to church. You'll ask them to go to mosque, or a Hindu, you ask them to go to a mandir, right? So thinking about those tiny little aspects, but overall, you don't really need to make a huge sort of difference. One thing that people need to be aware of is the style of communication. Now, for example, in our cultures, people still see therapists and physicians in a high esteem, right? There's a lot of respect for them, but that also means they don't expect the doctor to ask them of their opinion on such issue on different kind of causes or medication, choice of medication. I remember I had an Indian friend when I was in UK, and after MRC psych, he went back to India, and he came back after a year to for a break, and we were talking, and he told me how he asked a patient, so what do you think is wrong with you? And the patient said, you're the doctor, you should tell me what's wrong with me. So in our cultures, you see, people expect you to just look at them and diagnose them. That's in their mentality. That's in their belief system. Because you see, we hear, and I'm sure you must have heard the stories, although you're very young, but I'm sure you must have heard the stories of these old practitioners of Ayurveda or Hakim, and so all these people who would just look at the patient and diagnose. So these are the kind of the stories which actually influence people. So patient expect you to tell them what's wrong rather than asking them what's wrong with you, because that's the Western style. Right here, I ask a person, what do you think is wrong with you? What do you think is causing your problem? Okay, but you can't do that in South Asia, apart from a small kind of urban, highly educated people who have exposure to the Western model of psychology and psychiatry. We also here we use a Socratic kind of model of dialogue, right? So and the therapist and patient is kind of equal, but that doesn't work like that in our cultures, because as I said, people still see the psychiatrists or physicians in a high esteem. So our model of communication with a person in authority is the Buddha style, the sermons, not the equal on the same level communication. And that's why you'll see that even now we still have so many we have more legends even in modern day, the way, for example, cricketers or movie stars are treated in India and Pakistan is very different from the way they're treated here. So we have this inbuilt thing about putting people on a pedestal, while in the West, yes, there are celebrities, but in general, people are seen in a more kind of equal level. And that has serious implications, again, because if you start treating a patient totally equal, and that doesn't mean that you're being disrespectful. That means, like, you're respecting the authority that the patients give you. So rather than a Socratic model of communication of two persons or equal work together, I say to therapists in India and Pakistan and another South Asian country, that you start with the teacher and student or guru chela kind of model, sophisticated modern kind of way rather than another old-fashioned guru chela, right? And you start with that, and then when the patient is more comfortable, then you can, try to treat them equally, making sure they are comfortable with that. Because if a person is not comfortable with the way you're treating them, even if you treat them equally, they might not engage with therapy.
Right. Makes sense.
Yeah.
Okay. So what is multicultural counseling?
So multicultural counseling simply means, providing counseling to people from different cultural backgrounds and being aware of their cultural needs.
So if a client is suffering from racial discrimination, how can a therapist help counsel that?
Yeah, I mean, that's a very common situation here in the West. And although I think, we in South Asia, we don't possibly use the kind of racial discrimination, but we discriminate each other on different levels. So discrimination is everywhere, unfortunately, even in this day and age. And racial trauma, or due to racial segregation or racial discrimination, can and especially, I think you need to think about one thing, that many of these people, they're experiencing racial discrimination from a very young age. So obviously it leads to a lot of mental health problems. It can cause anxiety, depression, and even some people experience post-traumatic stress disorder. So these are the kind of factors that need to be addressed. But the way to deal with it is to start talking about this thing, because many therapists are not comfortable even talking about these things. And so here we encourage people to talk about their racial, to talk to their clients about their experience of racial discrimination.
How can a therapist keep aside their own personal biases when dealing with a person from a different culture?
Yeah, so as I said, the main thing they can do is by being aware of them, and humility helps, when because let's think about it, right? How does our personal biases operate? Okay, so I might believe that because I'm a Muslim, so I'm better than you, right? Or I might think that because I am of Pathan background, so I'm superior to you. And similar kind of biases about your language or your religion and that kind of stuff. And they so the first step is to be aware of them. Second thing should be to try to make sure that you put your biases aside. You put your arrogance or your belief that you're better than others outside your therapy room when you see someone. But the beginning is always awareness, self-awareness, and by being self-aware, you can then think about the common sort of qualities or positive things in other people, you know. So yeah, but the main thing is really being first step is really being aware of your biases. Yep.
Okay. What are the challenges faced by a CBT practitioner when dealing with a client from an individualistic culture versus a collective culture?
Yep. So the main thing really is working with the families, you know, because when we say collectivistic sort of cultures, um, uh, even collectivist cultures are they have a kind of lot of layers, if you like.
Right.
So, for example, you know, people living in urban areas, so in South Asia, they don't live in the clans in the kind of like someone in a village lives. Okay, so in a village, the whole village is a community. In a city, it'll be just like your immediate family, or in some cases, extended family. So that's something to keep in mind, that you know it's not there's no universal kind of definition, or and especially we need to keep in mind that at least South Asia is becoming westernized at a very fast pace, sorry, you know. So you see McDonald's and Burger King and Pizza Hut, and you know, even the way we are dressed in South Asia is very westernized now. And similarly, the whole kind of institute of marriage is falling apart. And it's not really, you know, I don't think it's good or bad, because it is understandable, because the value system is changing. You know, there was a time 2-3 generation back when people would divorce because of kids and because of the stigma. Now that stigma is kind of less, and therefore, and I'm sure you know the rates of divorce has increased in our cultures. So anyway, going back to your point, so the main focus now, I think, in many cases is family. And how you engage family, how you involve family in therapy. Now, I say to people, you don't have to really just, you know, ask the whole family to come in and sit in therapy section, but you know, you need to at least talk to the family once or twice, explain to them what you're going to talk to the patient about, how you're going to help them, what's the therapy about, and then keep one person engaged throughout the therapy. Again, they don't have to sit in the therapy sections, but they can actually, you know, you can talk to them with patient's permission. That's another interesting thing. Now in the West, you know, we need patient's permission about everything. In South Asia, there is no such concept. You know, you can call it whatever you want from a Western point of view. And I'll be very honest, when I started working, I thought, oh my God, that's so bad. And now I have realized that's the way people live. We can't judge people from other cultures using a Western lens. We have to accept that's how people live in other cultures. That's how people operate. That's how people connect. So yes. So engaging the family, having a member of the family as a co-therapist can help, because you know, people have so many secrets in our family system. You know, we call them family secrets, and people are worried. You know that, and some of them might be just really. You know, not kind of terrible secrets, like, for example, it can be that parents were divorced when the kid was 5 years old and nobody told the kid, and etc., etc. It's a very common thing in our cultures, right? So being aware of that, being respectful of the family. In other words, when you are dealing with someone in the South Asian culture, you're dealing with the whole family, right? So you might have a young married woman presents with depression, and then you realize that that there are conflicts between wife and husband because mother-in-law, and it still happens. So this is not really something, So mother-in-law thinks that the wife now has all the attention of son.
Yes.
It's so common. It's so common, So how do you engage this person and this family? If you do not do anything about the conflicts between mother-in-law and daughter-in-law, you're not going to make a big difference in that woman's life.
Due to the stigma attached to even take one person to therapy, especially in South Asian countries, how can we provide therapy for the family?
Yes. So you see, here I'm not saying you provide therapy for the family, but at least you can engage them, meet with the family once or twice, and explain to them. And you don't have to say, that stop being the typical mother-in-law from Indian dramas, but you can say, that look, this is kind of normal. Your son is like, a young man, 24 years old, and the girl is 19, and for God's sake, it's understandable if they are they're kind of, and they is their first relationship. Very often, even now these days in our culture, apart from the urban areas, right? In cities, I know that people get into relationships outside of the marriage, and in rural areas too. But still, it's not that common and open as is in the West, So it's a matter of educating people that your son is not going anywhere. It's going to be your son forever. You need to give them some space and allow them to do their things as well. That's fine, and it does help. And one thing that I always recommend, is to engage someone from a religious or spiritual background. Because as I mentioned, that's a very important aspect of our cultures. And a lot of these things come from religious or even generally our belief system. A big part of our belief system comes from our religion and spiritual values. So for example, one person who's and you have to also keep in mind, in the old times, now we have all these kind of boundaries of countries and things. In the old times, they did not have these boundaries. So, for example, you'll see the teachings of Buddha in East Asia, and you'll see the teachings of Confucius are still popular in India and other parts of South Asia. So it's not really like that you and for ideas, there are no boundaries anyway, no borders, right? So Confucius, for example, his teaching, a big part was respect of the elders and family piety or respect or love for the family. And the problem is, most cultures in most cultures, especially the patriarchal societies like South Asian societies are, and Eastern societies, Chinese and the rest, they have taken things to an extreme. Okay, they took things to the extreme, and then in some cultures, even and even in the older ancient culture, they were before the kind of the organized religion started. I'm sure you must have read that there were some societies in which they used to worship their elders, and the elders were part of were like a connection between people and God or whatever. So elders always had that kind of significance, and they still have their significance. But we need to kind of slowly help the family and the person to kind of come to terms with the fact that this is something you need to compromise. Things have changed. These are not the kids, who is going to listen to whatever you say and accept it. Kids are challenging every old value and system in South Asia and Asia. But these are more sort of societal issues. However, they do come into play during therapy, as you can imagine. So how do you address these conflicts between parents and children? And the only way you can help them is by engaging a religious or faith healer. I give you an example. So I have one example. I stayed and worked in Pakistan for 3 years between 2006 and 2009 when I was doing my PhD in Southampton University, and that was on my major work, cultural adaptation, or CBT. And I remember seeing this young guy. He was an engineer, and he was living in a small city with his parents. And he had full BE or whatever degree he had. But he was not working as an engineer. He was working some other job, and he was not very happy about that. He wanted to get back to a bigger city. His father told him that it'll be a sin if you don't live with us. You should live with your parents. Now we're getting old, etc., etc. Even though he had other sons who were working, living happily there. So he had severe anxiety, and so I saw him, for a few sessions, and the main conflict seemed to be around leaving the city. So I tried to teach him assertiveness communication to help him, right, so that he can talk to his father. Nothing worked. And then one day when we were talking, he said, my father says it's like a sin in Islam and all that kind of stuff, So, and I do have, reasonable, because I have an interest, because my work in culture, I also have an interest in religions. So I have a decent kind of working knowledge of Islam and Christianity, Hinduism, Judaism, and Sikhism, etc., etc. But anyway, I knew one thing: I do not have the religious authority.
Yes.
Right? This is the kind of issue then. So you can't say, go and tell your father that no, it's not really, in a religion anywhere, that you just do whatever your father asks you. And so I used to work with or meet with the religious healer, because I was very interested in Sufism at that time, and I still am. So he said to me, he agreed with me. So I asked this young man to go and see this religious scholar. And he talked to him a couple of times, and that helped him. So you see, because he has the authority. He gives him examples from the religious from the religious text, and that works. So that's why when it's very important for therapists uh, to have a good understanding of the religion of the client, but also be ready to refer a patient to a religious leader so they can address the belief system when you can't do much about it.
Last question I would like to ask you is, can you tell us a bit more about your work and how can one contact you?
Yeah. Well, the best way to contact me is through my email, which is my full name at yahoo.com. My Twitter is the kind of easiest kind of way, which is Farooq Naeem 7. And my work really, I think so as I said, I developed this model of adaptation that I call Southampton Adaptation Framework, for CBT, which is being used in quite a few countries. We have conducted, I think, more than 30 randomized controlled trials to test this model. But above all, I think it has helped me as well in understanding people in their cultural context, and it has helped me a lot about my personal growth, to be honest with you. It was like when I started, it was quite interesting. I'll give you an example. Another example. I was seeing when I was looking at the results of my qualitative studies, 2006, 7 or 8. I noticed a lot of patients were saying, okay, so this was about the causes of mental health problems. Okay. So many people were saying, the usual causes like psychological problems, social kind of problems, biological, like genetics, as I said. And many people obviously also talked about the spiritual causes like, nazar, evil eye, and so on and on and on. But then there were some causes that I found very strange. So, for example, one person said the mental health problems are because of increased phlegm in the body, right? Another said increased heat in the liver. Another patient said it's because of excessive masturbation. So these were the kind of things that really surprised me and took me some time to kind of explore. And I asked around and read a little bit more, and then I realized that the phlegm is the Greek concept.
Right.
The old Greek medicine concept. Heat in the liver is the old Chinese medicine concept. Excessive masturbation is the Ayurvedic concept, right? And then I kept kind of, sort of exploring why all these different concepts in South Asia. And then I realized because of the mix of all these cultures, you see, because there was so much, there was not just like when in the old times when not just through the armies, but also through trade routes, through when people traveled from one place to another, they had their physicians with them. They had their medical concepts with them. So that's how these concepts kind of spread throughout the region. So in other words, it's quite fascinating when you think about it, how
Yes.
right, how people from different cultures. So what we are seeing today is just really a fast-paced version of what happened in the past. Because even today, right, now in people in the West, because of Google, people know
Yes.
in the West a lot about East, and people in the East know a lot more about the West. But in the old times, the knowledge was more kind of localized, so it was more like Asia, and apart from Greece, and then the Roman Empire, Western civilization started at a later age anyway. But it's quite sort of fascinating how people always had a mix of thoughts and beliefs, and not just medicine, in philosophy and in different aspects of culture, religion, and so while these things cause confusion, and different ideas, but I think they also help us to grow as human civilization by learning from each other and sharing the concepts about causes and the effects, and so on and on and on.
It's very fascinating. It was, yeah, I'll just cut it short because I think it's been 40 minutes. Uh, it's been a pleasure talking to you, and thank you for all the insights you have shared.
Thank you so much. It was a pleasure talking to you as well, and you take care, and good luck with your channel.